Good day, everyone. I am Crystal Carion from BSN 3A, and together with me is Miss Antoinette Colleen Carancio, Mr. Kyle Cedric Duran, Mr. Zeus Zachary Turan, and Miss Luella Jean Rilon. And in this video, we will discuss about neurologic trauma, the head injury, the brain injury, and the spinal cord injury.
Hi and good day everyone. I am Antoinette Carancio from BSN 3A, and in this video I'm going to discuss about the pathophysiology of the spinal cord injury, and this is under the neurologic trauma. So let me try to zoom this in. Spinal cord injury starts when there is a primary trauma or when there is a direct mechanical trauma. So when will this happen? It happens when there is contusion or compression in the spinal cord area. So as we all know, our spinal cord is also made up of bones or the vertebra or vertebrae. And this vertebrae, since these are bones, it can fracture or it can break. So when this breaks or fractures because of traumas, it will create fragments, and these fragments will also directly damage the center of the spinal cord. So damaged neural tissue of the spinal cord, for example, that involves the disruption of axons. As we all know, the axons plays a very important role in the sending of the signals. So when there is a disruption, when it is being damaged because of the trauma, no signals will be sent. Next is damage of the cell membrane. So our cell membrane keeps the inside of the cells intact. We all know that. And when there is a damage of the cell membrane, the components leaks out of the cell. And lastly is when there is a damage of the blood vessels. So this is where the secondary injury starts. So secondary injury evolves because of the primary trauma. So secondary injury is when there is hypoxia, ischemia, or when there is a decrease of oxygen that goes within a certain tissue or cells. So when there is a damage of the blood vessels, as we all know, and as expected, it will leak out. So fluid will leak out that would cause an increased pressure at the spinal cord. So this can also be considered as a shock, especially if too much fluid will leak out. And since too much fluid will leak out, there would be a decrease in nutrient supply and also decrease in oxygen. So a decrease of these two means that cell can no longer make energy, since these two are very important in making energy. So when there is no longer energy, there would be a failure of the sodium and potassium pump. And sodium and potassium pump is very important in the action potentials. As we all know, sodium goes inside the cell, and when it reaches a certain threshold, there would be a firing of the action potential. So that is what the axons as what I've mentioned a while ago. So that's what it does. So it sends a signal or synapses to the other neurons. So when there is a no oxygen, there would be a failure of the sodium and potassium pump, since this process needs oxygen. So since dili man siya magkagawas ang sodium, there would be an accumulation of sodium inside the neuron, too much of sodium inside the neuron. And since there is too much sodium, what will happen is that another pump will take action, and that is the calcium pump. So the sodium swaps with calcium, and calcium will take over. It will go inside the cell. There would be a calcium influx, and calcium influx, or an accumulation of calcium inside the cell, that would lead into cell damage, which will lead into cell death. So let's go right here. As what I mentioned a while ago, when the fluid leaks out, there would be a decrease in overall blood pressure. Though there is an increased pressure in the spinal cord, there would be a decrease overall blood pressure, since as what I've mentioned, it can also be considered a shock. So, a decrease in overall blood pressure would activate the flight and fight response of our sympathetic nervous system. When this is activated, there would be constriction of blood vessels, and including the blood vessels in the spinal cord. So, Since ni ubos naman kayo ang BP sa client or sa person, what will happen is the flight and fright response of the CNS will take action to compensate para mo taas balik ang BP, iyang i-constrict ang blood vessels. So the constriction of blood vessels will include, unfortunately, it will include the spinal cord since dili man niya ma-differentiate. So when it includes the spinal cord, there would be a further limit of the oxygen and nutrient supply in the spinal cord, and that would also lead into cell death. So this is the complete type of the primary trauma. Now let's go to the incomplete. So this is more on the syndromes that is caused by the trauma. So first is our anterior cord syndrome. So here is a picture for reference. Our arterial cord syndrome affects the arterial spinal artery, and this spinal artery is very important in the spinal thalamic tract, which is responsible for the temperature and pain, and the corticospinal pathway, which is also responsible for the motor or the voluntary movement of our body. So when this is injured or when there is a damage, there would be a loss of pain and temperature perception, and complete loss of motor function at and below the level of injury. So a picture here is for reference, as we can see the red part of the spinal cord here. This is the anterior part, and let's go to the next slide just for reference. Okay, so ang affected ato sa anterior cord syndrome is this part. So it will affect the motor and as well as this one, pain and temperature, and this area, basically this area. So when it affects that area, there would be loss of pain and temperature, perception, and complete loss of motor function at and below the level of injury. So next is the central cord injury or central cord syndrome. So this is also for reference. From the word itself, central, that means that the lesion is at the center. So there would be a cord compression, and this exists often with pre-existing spondylosis. And spondylosis is a condition wherein it changes the structure of the vertebra or the vertebrae or the spine of a person because of age. So it also causes cord compression. So when there is cord compression, that would lead into upper extremity weakness, since by the way, the central cord injury affects the cervical region of our spinal cord. So cervical, this is around the neck, siya ang pinakauna na region. So when it affects it, it is responsible for our kanang sa upper part sa atong body. So there would be upper extremity weakness. If na damage, there would be upper extremity weakness that would lead into upper extremity dysfunction, and that would lead into clumsiness since na may weakness. So that could also lead into pain, the compression of the neck, so that could lead also into neck pain. Next is the posterior cord injury. We have, let me move this. Okay, so we have the posterior cord injury or the posterior cord syndrome. So there would be a posterior spinal artery injury, and that would lead into loss perception of vibration. Let me go into the next slide. Okay. So here, for the posterior, this part right here is affected. Fine touch, proprioception, which is responsible for the our sense of movement, balance, and the like, and vibration as well, and our motor is affected. So when there is a posterior spinal artery injury, there would be a lost perception of vibration and proprioception. And since there is a lost perception of proprioception, that would also impair involuntary coordination since maapektuhan man pod ang atong motor. So that would lead into frequent falls, poor coordination, and decreased balance. And then lastly is we have the Brown Sequard syndrome. This is also known as the lateral cord compression or injury. So from the word itself, hemicord lesion, hemichord means half ra ang naapektuhan. So this is just for reference as well. Kaning red part, for example, that part is being affected. So there would be an ipsilateral loss of motor function, vibration, and proprioception below level of injury, and contralateral loss of pain and temperature below level of injury. So there is a contralateral because the sending of these signals involves two neurons. So for example, ipsilateral, it means on the same side. So for example, you are being pricked on the left side, it will travel into your periphery and it will transfer into the right side and go to the brainstem, to the thalamus, which is considered the sorting center, and it will be interpreted by the brain. But if it is being damaged, the opposite side will also get affected, and most especially the same side. So that is just the pathophysiology of the spinal cord injury. Once again, this is Colleen Carancho, and God bless.
For neurologic trauma, which is the traumatic brain injury, we will going to define first what is brain injury. So, a brain injury, it is the injury to the skull or brain that is severe enough to interfere with normal functioning. So, for the types of brain injury, we have the diffuse axonal injury and also the focal brain injury. Okay, first let's have the focal brain injury. This type of injury, it includes the contusions and any several types of hematomas. Then for the diffuse axonal injury, it results from the widespread shearing and rotational forces. So due to shearing and rotational forces, it will going to produce brain damage throughout the brain, specifically to the axons in the cerebral hemispheres, corpus callosum and brainstem. So it is also associated with prolonged traumatic coma, and it is more serious with a poor prognosis compared to the focal lesion or focal brain injury. Then for the damage of the brain, it may take into two forms, which is the primary injury and secondary injury. For the primary injury, it is the consequence of direct contact to the head or brain during the instant of initial injury. And for the secondary injury, it also evolves over ensuing hours and days after the initial injury and results from inadequate delivery of nutrients and oxygen to the cells. For the pathophysiology of traumatic brain injury, so based on the Monroe-Kelly doctrine, which I get my source, so the cranial vault contains of three main components. So the cranial vault, the three components are the brain, blood, and cerebrospinal fluid. So since the cranial vault is a closed system, and if one of the component will going to increase in volume, supposed to be at least one of the other two components should or must decrease in volume or the pressure will going to increase. So example, if the patient is suffering from traumatic brain injury, so there will be a bleeding or swelling within the skull, and it will going to increase the volume contents within the skull. So therefore, it will causes increase in the ICP, which is at the intracranial pressure, wherein the brain tissue expands and the inflexible cranium and the intracranial pressure will going to exert by the volume of the intracranial contents within the cranial vault. So it will going to rise and the cerebral perfusion is impaired. If the pressure increases enough, it can cause displacement of the brain throughout and against the rigid structures of the skull, so which it causes restriction of the blood flow to the brain, and it will going to decrease the oxygen delivery and decrease in the waste removal. So then the cells within the brain become anoxic and cannot metabolize properly. It will going to produce, or the ischemia will going to occur, and also the infarction. So then the intracranial pressure continues to rise and their brain may herniate. Since it is irreversible brain damage, the cerebral blood flow will go into ceases or eventually can lead into brain death. So for the clinical manifestations, actually it depends upon the severity and the location of the injury. So, for example, we have the scalp wounds or the scalp injury. It tends to bleed heavily and are also portals for infection. So, although the skull injury is classified as a minor injury, it is still a life-threatening because if there is a large avulsion or a tearing away of the scalp. And then we also have the skull fractures. For the scalp fractures, it is usually have the localized persistent pain for the fractures of the base of the skull. So it is a break in the continuity of the skull caused by forceful trauma. It is classified by type or by the location. And any fracture of the base of the skull is called as the basal skull fracture. It tends to transverse the paranasal sinus of the frontal bone. Therefore, frequently it will going to produce hemorrhage from the nose, pharynx, ears, and blood that appears under the conjunctiva. And then it also have the CSF leak, which is a hollow sign ring of fluid around the blood stain or from the drainage. Another clinical manifestation, it is the altered LOC or level of consciousness, pupillary abnormalities, or sudden onset of neurologic deficits and neurologic changes in sense, movement, and reflexes, then changes in vital signs, headache, and seizures. So now let's proceed to the brain injury, which is a close or blunt. So, and when the head accelerates and then rapidly decelerates, or it will going to collide with another object, like for example, in the wall, or a person is bumped into a wood door, so the brain tissue is damaged, but there is no opening through the skull and dura, so that is called as the brain injury, close or blunt. And if the object penetrates the skull and enters the brain, damages the soft brain tissue, and in its path, or when the blunt trauma to the head is so severe already, which it opens the scalp or the dura to expose the brain, it is also called as the brain injury, open or penetrating. For the diffuse axonal injury, it is the widespread axon damage in the brain that can be seen within the head trauma. So the patient develops immediate coma, and it can also have the intracranial bleeding, which are the epidural hematoma, subdural hematoma, acute and subacute, and chronic. And then we also have the intracerebral hemorrhage and hematoma. So concussion is an example of a diffuse axonal injury because the patient may be admitted to the hospital for observation, or it can be sent home. So it can also have the observation of the patients after head trauma, and then it will be going to report immediately if there is a changes in level of consciousness as being observed. And then also have difficulty in awakening, lethargy, dizziness, confusion, and irritability, or the anxiety. Then it is also important to report immediately if the patient is having difficulty in speaking or movement, severe headache, vomiting, and then the patient should be aroused and assessed frequently. So in this picture, we have the locations of subdural and the intracerebral and the epidural hemorrhage. Then in this picture, we can see the epidural hemorrhage. So for the epidural hemorrhage or epidural hematoma, so there can be a blood collection in the space between the skull and the dura. So the patient may have a brief loss of consciousness with a return of lucid state. Then as hematoma expands, it will going to increase the ICP or the intracranial pressure that will often suddenly reduce the level of consciousness. Then the patient will going to have an emergency situation. So for the treatment, it includes the measures to reduce the intracranial pressure and then remove the clot and to stop the bleeding, burr holes, or the craniotomy. Then the patient will need to be monitored and support of vital body functions, especially to the respiratory support. Next, we have the subdural hematoma, collection of blood between the dura and the brain. So there will be also acute, and subacute. So for the acute, it can have a symptoms that develops 20 to 48 hours. And then for the subacute, it can also have the symptoms that develop over 48 hours to 2 weeks. Then, if the patient have an acute or subacute, it requires immediate craniotomy and control of ICP or intracranial pressure. Then, if it is chronic, then it develops over weeks or months. Then, it is causative injury may be minor or forgotten. Then, the clinical signs and symptoms may fluctuate. And then, the treatment is evacuation of the clot. And for the intracerebral hemorrhage. So this hemorrhage occurs into the substance of the brain. It may be due to trauma or non-traumatic cause. For the treatment of the intracerebral hemorrhage, we have the supportive care, the control of ICP or intracranial pressure, then administration of fluids, electrolytes, and antihypertensive medications. For the craniotomy and connectomy is to remove clot and to control hemorrhage. This may not be possible due to the location or lack of circumscribed area of the hemorrhage.
Diagnostic evaluation, which includes physical and neurologic exams, skull and spinal x-rays, CT scans, MRI, and PT. The nursing process, the care of the patient with brain injury assessment, health history with focus upon the immediate injury, time, cause, and the direction of the force of the blow. So, the time when did the injury occur, the cause, what caused the injury, like an object striking on the head or a fall, and the direction and force of the blow, which is the intensity of the blow. Then, the baseline assessment, the Glasgow-Coma scale, or the level of consciousness. So if you assess the level of consciousness, you would use the Glasgow-Coma scale. Frequent and ongoing neurologic assessment, multi-system assessment. The nursing process, the care of the patient with brain injury or their diagnosis. There are different kinds. Ineffective airway clearance and impaired gas exchange, ineffective cerebral perfusion, deficient fluid volume, imbalanced nutrition, risk for injury, risk for imbalanced body temperature, risk for impaired skin integrity, disturbed thought patterns, disturbed sleep pattern, interrupted family processes, and the deficient knowledge. The nursing process, the care of the patient with brain injury or planning. The major goals may include maintenance of patent airway, adequate CPP or the fluid and electrolyte balance, adequate nutritional status, prevention of secondary injury, maintenance of normal temperature, maintenance of skin integrity, improvement of cognitive function, prevention of sleep deprivation, effective family coping, increased knowledge about rehabilitation processes, and absence of complications. So the nursing interventions, number one is maintaining airway. The second nursing intervention is monitoring neurologic function. Then number three is the vital signs. So this intervention is on vital signs is critical. It is because the patient may be at risk of external bleeding or internal bleeding from the patient's brain. Then 4 is monitoring fluid and electrolyte balance. So it means that the patient is in state of hypovolemia. Then promoting adequate nutrition, maintaining body temperature, maintaining skin integrity, supporting family coping, preventing sleep pattern disturbance, and monitoring and managing potential complications. So that will be all for neurologic trauma.
About head injury. Head injury is a broad classification that encompasses any damage to the head as a result of trauma. It describes a vast array of injuries that occur to the skull, the brain, and underlying tissue and blood vessels in the head. Head injuries are also commonly referred to as brain injury or traumatic brain injury or TBI, depending on the extent of the head trauma. It is also considered to be one of the most common causes of disability and death in adults, wherein the injury can be as mild as a bump, bruise or contusion, cut on the head, or can be moderate to severe in nature due to a concussion, deep cut or open wound, fractured skull bones, or from internal bleeding and damage to the brain. We'll be discussing about the pathophysiology of head injury. We have here the legend, etiology, pathophysiology, the manifestations, the complications, and the disease. So first, let's talk about the precipitating factors and the predisposing factors. For the precipitating factors, first we have falls, especially in older adults and young children. Falls are considered to be the most common cause of traumatic brain injury. As for the motor vehicle crashes and other transportation-related causes, the common cause of traumatic brain injury includes collisions involving cars, motorcycles or bicycles, and pedestrians involved in such accidents. As for the violence, it may include gunshot wounds, people who suffer from domestic violence, child abuse, and other assaults are the common causes. So, shaken baby syndrome, it is a traumatic brain injury in infants caused by violent shaking. As for the explosive blasts and other combat injuries, explosive blasts are a common cause of traumatic brain injury, especially in people who are involved in active duty military. Traumatic brain injury also results from penetrating wounds, severe blows to the head with shrapnel or debris, and falls or bodily collisions with objects following a blast. As for the sports activities, traumatic brain injuries may be caused by injuries from a number of sports or physical sports, which includes basketball, soccer, boxing, or football. For the predisposing factors, we have the age, males in any groups, because as we all know that males is dominant in this phase, wherein males are more involved in accidents compared to females, and prior history of substance abuse. So all of these precipitating factors and predisposing factors that I have discussed can cause trauma, which injures the head and causes traumatic brain injury. Traumatic brain injury is classified into three. We have closed head traumatic brain injury, penetrating traumatic brain injury, explosive blast traumatic brain injury. So first, let's discuss about the closed head traumatic brain injury. Closed head TBI is typically caused by a blunt impact incurred mainly from motor vehicle accidents, falls and sports activities. So the strong blunt or the compression contact force disrupts the normal functioning of the brain directly underneath the site of impact, thus causing immediate damage to brain vasculature and neuronal cells. So because of this, there is a brain displacement because of the vibrations and shocks, which later on can lead to compression of brain tissues and reduction of cerebral blood flow. So both these mechanisms can eventually result in focal localized contusions or diffuse injury to brain regions. As for the penetrating TBI, this is where it results when a foreign body penetrates the skull and traverses through the dura into the brain parenchyma. So similar to closed head TBI, laceration of brain tissues primarily cause focal damages, intracranial hemorrhage, cerebral edema, and ischemia. The invasion of fast-moving projectile can lead to tissue cavitation, which further exacerbates injuries. So, due to the exposure of the tissue cavity, um, it will lead to due to the exposure of um, brain tissue to the harsh environment, the chance of infection is relatively high in this form of traumatic brain injury. As for the explosive blast traumatic brain injury, the brain is compromised by a rapid pressure shock waves generated from explosion, which can result or transmits tremendous energy or amount of energy from the skull into the enclosed brain parenchyma. Because of the energy being generated in the blast, it causes deformation of the brain, thus creating a widespread diffuse injury on the gray and white matter. So, due to the widespread diffuse injury on specifically on the gray and white matter, it leads to neuronal cell death, axonal injury, compromised blood-brain barrier, vasospasm, pseudoaneurysm formation, hyperemia, contusion, and cerebral edema. To further discuss the pathophysiology, Mr. Zeus Katuran will continue discussing about the primary injury.
Hello, Doc. My name is Zeus Zachary, and today I will be um, discussing primary and secondary impact to the head, which can result in two types of injury: the focal or and the diffuse. The focal is the localized damage in the part of the head or in the brain, while the diffuse is the widespread damage to the part of the head. There are 7 types of injury, starting with concussion, which is under the diffuse type of injury that can lead into brief loss of consciousness, headache, nausea, and vomit. The next is contusion, which is small bleed or bruise in the brain tissue that can lead in changes of consciousness, dysfunction, and seizure. Next is the epidural hematoma. It's a bleeding between dural and the cranium and results in changes in local level of consciousness, headache, seizure. It can also vomiting and dilatation of pupil. Next is the subdural hematoma. It is the bleeding between the dura and the subarachnoid, in which it causes the decrease of level of consciousness of the patient. It also causes headache, confusion, agitated state of the patient, and seizure. Next is the traumatic subarachnoid hemorrhage. It is the bleeding of the subarachnoid membrane that can result or affect the level of consciousness of the patient. It also causes headache, confusion, seizure, and focal deficits. Next is the intracerebral hemorrhage. It's the bleeding in the brain tissue that results in headache. It also affects the level of consciousness of the patient, the focal deficit, and it increases the intracranial pressure of the patient. And lastly is the diffuse injury, in which it is the shearing of axons that can result or affects the level of consciousness of the patient. It also leads into coma and abnormal posture of the patient. So for the second injury, is the continuation of the damage in the brain over a period of time or days after the primary brain injury. What happens here is that after the first brain injury, the injury will eventually lead into secondary brain injury, which is going to be an ischemia or cellular changes that will result in additional neuron cell damage. Eventually, it can cause death. So after the primary head injury, it can cause tissue damage from the after the primary head injury, it can cause tissue damage, and then after the tissue damage, because of damage to the blood vessels in the brain or the axonal shearing, it will eventually lead into edema or swelling. This is caused by an inflammatory response in the head. And with the edema and swelling, it also increases the intracranial pressure. With the intracranial pressure, cerebral vasoconstriction will be present, because this is an attempt to the body to help to reduce the ICP by reducing the cerebral blood flow that contributes to the increasing ICP. So after the cerebral vasoconstriction, it will lead into cerebral ischemia. This is because the insufficient cerebral blood flow to maintain adequate perfusion. So after anang cerebral ischemia, mag-increase na po siya o vasoconstriction, because mo-attempt na po siya o increase sa blood flow, which will eventually mo increase na po diyahang intracranial pressure. And so after the second intracranial pressure, the decompensation starts. So with the ICP again, it also increases. It increases this to approach the mean arterial pressure. This is due to edema, swelling, and this is due to the edema and swelling in the brain. And then after the mean arterial pressure, magpa-decrease na po siya CPP. This is the pressure in the brain is now higher than the pressure trying to get blood into the brain. So with the decreased CPP, magka-cerebral ischemia na siya. And then after sa cerebral ischemia, magka-herniation. Nagka-cerebral ischemia siya. This is because the further tissue damage in the brain. And then sa brain herniation niya is that this is because nag-continue og swell ang sa iyang brain, and then which will eventually lead into brain death.